This is Chapter 1, Module 3, Anatomical Terminology. The learning objectives of this module are 1. Match body positions with the correct descriptions, 2. Use correct directional terms in the study of anatomy and physiology, and 3. Match locating landmark terms with the correct descriptions. Before studying anatomy, a student should become aware of some of the vocabulary that's used to describe various aspects of the human body. If everyone uses the same terminology, then it's easier to understand what each of us is trying to say. So before learning the particulars about the anatomy of a region, we will take a look at some of the terminology. For the purpose of description, the body is considered as being what is called the anatomical position. In the anatomical position, the body is standing, the feet shoulder-width apart, the arms to the side, the head and the eyes forward, and the palms of the hands facing forward. To ensure consistency of description, it is important to keep the anatomical position constantly in mind. This last point is an important one, since in a normal relaxed position of the body, the thumb points forward or anteriorly. In the anatomical position, the thumb is facing outward or laterally. So just remember, this standard anatomical position, standing straight, looking forward, arms at your side, palms facing forward, keeps everyone on the same page when you're talking about anatomy and physiology. Anatomical directional terms are like the directions on a compass rose of a map. Like the directions north, south, east, and west, they can be used to describe the locations of structures in relation to other structures or locations in the body. This is particularly useful when studying anatomy, as it provides a common method of communication that helps to avoid confusion when identifying structures. There are several terms that describe positions and directions of the body that you need to memorize. Anterior means front or towards the front. Posterior means back or towards the back. Dorsal also means back or toward the back. Just think of a whale's dorsal fin. And ventral also means front or toward the front. Think of an air vent facing the room. Anterior and ventral are synonymous, as well as posterior and dorsal. For example, the eyes are on the anterior or ventral side of your head, whereas your shoulder blades are on the posterior or dorsal side of your body. Other terms are lateral, which means away from the midline of the body, or medial, which means toward the middle of the body. For example, your nose is medial to your ears, and your eyes are lateral to the bridge of your nose. Proximal, another term, means nearer to the point of attachment, and distal means farther away from the point of attachment. Proximal and distal are used exclusively when discussing the upper and lower limbs, or in other words, when discussing the arms and the legs. Proximal refers to closer to the armpit, where the arm attaches to the body, and the hip, where the leg attaches to the body, whereas distal refers to closer to the tips of the fingers or closer to the tips of the toes. You could, for example, say the elbow is proximal to the wrist or closer to the armpit. Or you could say the elbow is distal to the shoulder or closer to the tips of the fingers. Superior means situated above or higher than another body part. Inferior means situated below or lower than another body part. Superior and inferior are used when referring to the entire body from the head to the toes, but isn't used when referring to just the arms or legs. That's when we would use proximal and distal. Cranial and caudal are other terms that may be used in place of superior and inferior when discussing directions, especially from the skull to the tailbone. Cranial means toward the head, and caudal means toward the tailbone. Superficial, another term, means on the surface or closer to the surface or toward the external structures of the body. Deep means below the surface or toward the internal structures of the body. For example, a mole on the skin is a superficial structure, whereas the stomach is a deep structure of the body. Anatomists and healthcare professionals use anatomical terminology to describe body parts and landmarks. Superficial anatomy includes anatomical landmarks on the body that can be palpated. In other words, these are structures that can be examined or explored by touch. It's important for health professionals to identify the location of these landmarks, as well as to be able to pronounce the terms correctly. These landmarks may be used as nouns or they may be used as adjectives. Typically, when they're used as an adjective, a word such as region or area will follow the adjective. For example, the term cervicis is a noun that refers to the neck, and cervical is the adjective that refers to the neck. So, a health professional may say the patient has pain in his cervicis, which is the noun. Or he may say that the patient has pain in his cervical region, which is the adjective. Either term is correct and can be used to describe these landmarks. However, it's best to ask your instructor which form you will be tested on. In the next couple of minutes, you should try repeating the terms as they are being identified in this video to practice your pronunciation of the terms. I will first say the noun, and then follow up with the adjective, and then give the meaning. For the head and the neck regions, the anatomical landmarks on the anterior view or on the front view of the body that you need to know are cranium or cranial region means skull, facies or facial region means face, frons or frontal region means forehead, oculus or ocular region means eye, bucca or buccal region means cheek, oris or otic region means ear, nasus or nasal region means nose, oris or oral region means mouth, mentis or mental region means chin, cervicis or cervical region means neck. This is also used for the same location on the posterior view of the body. Cephalon or cephalic region means head. Typically, this also refers to the posterior view as well. For the trunk on the anterior view, or on the front, the anatomical landmarks you need to know are thorax or thoracic region means chest, mamma or mammary region means breast, abdomen or abdominal region means stomach, umbilicus or umbilical region means navel, inguine or inguinal region means groin, pubis or pubic region means the area overlying the pubic bone. For the trunk, on the posterior view or the back, the anatomical landmarks you need to know are dorsum or dorsal area means back, lumbus or lumbar region means loin or low back area, sacrum or sacral region means the area right above the tailbone, gluteus or gluteal region means the buttocks. For the upper limb on the anterior view or the front view, the anatomical landmarks you need to know are axilla or axillary region means armpit, brachium or brachial region means arm, antecubitus or antecubital region means front of the elbow, antebrachium or antebrachial region means forearm, carpus or carpal region means wrist, palma or palmar region means the palm of the hand, phalanges or phalangeal region, and digits or digital region means fingers, and pollex means thumb, pollicis for plural. For the upper limb on the posterior view or the back, the anatomical landmarks you need to know are olecranon or olecranal region means the back of the elbow, manus or manual region means the hand. The brachium and antebrachium are also seen on the posterior view as well as the anterior view. For the lower limb on the anterior view, the anatomical landmarks you need to know are femur or femoral region means thigh, patella or patellar region means kneecap, crus or crural region means leg, tarsus or tarsal region means ankle, phalanges or phalangeal region, and digits or digital region means toes. Pes or pedal region means foot. Hallux means great toe, or hallucis for plural. For the lower limb on the posterior view, the anatomical landmarks you need to know are popliteus or popliteal region means back of the knee. Sura or sural region means the calf. Calcaneus or calcaneal region means the heel of the foot. Planta or plantar region means the sole of the foot. And the femur is also seen on the posterior view as well as the anterior view. This ends Chapter 1, Module 3, Anatomical Terminology.